Hey gang, want to elaborate a little bit on functional endocrinology, which we're teaching this weekend in La Jolla, California. This is a course written by Dr. Karazi and a dear friend of mine, Dr. K. And what we want to talk about is an overview of what we're going to be addressing this weekend. What I see is people try and deal with the endocrine system often in isolation, whether that's a conventional endocrinologist just giving you hormones or someone treating you through meds for your type 2 diabetes and insulin insensitivity. And one of the things Dr. Krausian taught me years ago is if you deal with the endocrine system in isolation, you're really going to have minimal results in your quality of life. What we have to do is honor the relationship between the brain, the endocrine, and the immune system. We first learned that the brain tells everyone what to do, and that still stands to be correct. Your central nervous system, your brain and spinal cord, tells every single system in the body what to do. However, the endocrine system also feeds back and tells the brain what to do. The immune system will feed back and tell the brain what to do. The endocrine will tell the immune system what to do, and the immune system will tell the endocrine system what to do. I used to joke and say, imagine you had Mr. Trump, Bill Gates, and Steve Jobs back from the dead, 3 CEOs that were asking with big egos to politely run a company together. And you know that those egos are going to get in each other's way. In my experience with chronic illness, it is usually the immune system that's throwing a tantrum and actually affecting the brain and the endocrine system. So what we're going to break down in more detail this weekend is what is corrupting getting that endocrine system to work properly. What if you went on T3 thyroid hormone for Wilson's protocol, or you're on some diabetic medicines to stop insulin insensitivity, and you're just not satisfied with your results? We know that type 2 diabetes is extremely inflammatory. We know that T3 binding at the receptor can only happen if we don't have inflammation in the body. So some of the key players for making sure you have a good ride with your corruption in the endocrine system is to make sure you've addressed blood sugar dysregulation. If you're a reactive hypoglycemic, if you're meal skipping, if you're doing keto and you don't know how to do it well yet, if you're in leptin resistance, if you are in insulin resistance, we have to get fuel inside the cell. Otherwise, you will be in a state of insulin spiking, insulin surges, and subsequent inflammation. The second thing we have to do is make sure we understand most Americans are essential fatty acid deficient in the omega-3 fatty acids. This is the EPA plus DHA specifically from fish oil. I've been tracking omega-3 index in our clinic for over 12 years now. I will tell you that vegan fats, in my experience, are good for you. ALA, or alpha-linoleic acid, is important in things like flaxseed oil or chia seed, but they do not raise the omega-3 index. It is EPA DHA fish oil or DHA from plankton if you're looking for a vegan source of that. The third thing we have to do is we have to get the liver biotransforming those hormones. If you use hormones but you don't lose hormones, you can get overbuilding syndromes. Many of our patients, whether it is post-oral birth control symptoms or hormone replacement therapy issues, often were given the right hormones, but their liver wasn't pre-treated to make sure that they can then clear those hormones to not make toxic metabolites that do things like give breast tissue swelling, ovarian syndrome swelling like polycystic ovarian syndrome, uterine fibroids, heavy periods, those kind of things. So my saying for hepatobiоtransformation is you want to use those hormones and then you want to lose those hormones. So pre-treating liver with clean diet, anti-inflammatory foods, and then sometimes targeted nutraceuticals is very important to make sure you have a good run with your thyroid hormone or your hormone replacement or your testosterone shots, whatever you're doing. Intact gut biome, 20% of estrogen clearance in the body is by the gut biome. So even if you have a very functional liver gallbladder and your gut biome's not intact, you're still going to get in things like estrogen dominance where you're not satisfied with what you're doing with your endocrine system. And then hypoxia. This is one of the most under-celebrated. This is low oxygen. If you're sleep apneic, that can be a cause of insulin resistance. Things that cause low oxygen cause inflammation in the body, and then hormones and receptors don't work. So this is just an overview of what we're going to be deep diving into. It's all in the peer-reviewed literature. I see it in clinic every day, and with many years of functional endocrinological practice, these are the pitfalls and why sometimes just correcting your thyroid hormone on lab is not going to be satisfactory. Hope to see you in La Jolla.